Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bangalore. So today I'll be discussing about blepharoplasty, and also I'll be demonstrating how it is done step by step. Basically, the blepharoplasty, also called as eyelid surgery. So this is done to improve the eyelids for various reasons. So there can be wrinkles around the eyes, so then folds around the eyes, so there can be bulges around the eyes, and also some age changes, sagging will be there. So to overcome, and also the dark circle problems will be there with few, and also the surrounding the eyes there will be a less fat, or it appears like a sunken eyes, also called as hollow eyes, vacant eyes, and also a vacant appearance, or like a illness appearance or a patient appearance. So for them to rejuvenate, we need to combine fat grafting along with the regular blepharoplasty. Blepharoplasty is done for upper eyelid as well as lower eyelid. Basically, for the upper eyelid, we do blepharoplasty for the wrinkles and folds, overhanging. So that can happen at any age, from early age to the late age, though it is very often found in the late age groups. In the lower eyelid, the basic problem will be either bulge, the dark circle, or the sunken eyes, one of these. So to overcome everything, so either we do a blepharoplasty or in combination with the fat grafting or fat removal. So these combinations are done. But overall, the aim of the blepharoplasty is to improve the eyelids and the surrounding region, to give them a rejuvenated, a youthful appearance. In this case, I am going to perform upper eyelid blepharoplasty on both sides. She had wrinkles around, especially the upper eyelid. She had multiple wrinkles, mainly because of loss of volume and excess skin. So for the excess skin, we are excising that excess skin. For loss of volume, so we are filling the sub-brow, means below the eyebrow, above this eyelid region, we are going to fill, so that this gives a youthful appearance. Similarly, in the lower eyelid region, this is also sunken eyes, so we are going to fill the fat grafting to give it a rejuvenated appearance there. So we harvest the fat from the abdomen, in this case using micro cannulas. So from there, then we process it, concentrate, purify, then we infiltrate in both the upper sub-brow region and below the lower eyelid region. This is called as infraorbital margin. So just above that, we will be filling this microfat grafting. So in this case, we make a tiny dot hole through which the fat is filled. Here through the eyebrow region, so we make the needle dot holes using micro cannula of 1 mm or 0.9 mm. We will be filling this area, so thereby it does not leave behind any scars. And this is, since it is sitting in the upper eyelid crease, so even the scar won't be visible. In this case, I am not going to do the lower blepharoplasty, but generally the incision comes 1 or 2 millimeters just below the lower eyelid margin, so that even the scar won't be visible later. So in this case, she requires fat grafting to fill around the eyes, both in the upper lid and lower lid. I am harvesting fat grafting from the abdomen. I have made a hole in the small tiny hole of around 2 mm in the umbilical region, so that this won't be visible in the later part, the scar won't be seen. So this is the micro cannula to harvest the fat. Through the syringe, we will be harvesting the fat. So the fat can be harvested from the inner thighs, from the outer thighs, or wherever the pockets of resistant fat. So lower abdomen, inner thigh, outer thigh is and inner knee. These are the common regions where we harvest the fat. And this fat grafting we make use for various reasons, to fill the face, to give them a rejuvenated appearance, and especially around the eyes, cheeks, temple region, and in the chin augmentation also, to give them a jawline definition. So this is basically mainly used in the face, but also it is used in the to augment the breast augmentation, buttock augmentation, to fill these regions also. Sometimes in the hands, where it is in the thin patients or aged patients having the wrinkles there, to fill that, to rejuvenate the area also, we use fat grafting. And this is the fat harvested. So this will be processed further to have only pure fat. After harvesting the fat from the abdomen, so we processed it. Then after that we got this purified fat. We wanted around 10 cc of fat in this case, and we have got almost 12 cc of fat. So we will make use to inject around the eyes using the very fine microcannula. Fat is transferred to now 1 cc syringe, and I am using 1.2 microcannula, a single hold, so through which we inject to the around the eyes. We have finished the case. In this case we have done a blepharoplasty. You can see that we have closed with very fine stitches here, removable stitches, which we remove usually after 1 week's time. So after that it heals very well, and there won't be any scars visible later. So here in the where we planned for the sunken eyes, we have planned for the fat grafting on both sides, and especially the upper and lower lid as well. So here you can see this is the fat grafting is put below the eyebrow region, which fills the upper eyelid, and in the sunken lower eyelid, which we have filled through a tiny dot hole, which you may not be seeing, but it was just the dot hole was made through a needle, and through which we have used the micro cannulae of 1.2 mm. So now you can see the fullness around the eyes. Of course the much rejuvenation will be seen after once the swelling goes down. So the patient will be discharged the same day evening with the plasters around there, and of course she'll be advised to stay at home for 1 week. After that we remove the stitches, but she can have normal body bath, and if she has got the scope to do work from home, she can do that from tomorrow itself or from day after tomorrow. There will be some swelling around the eyes for 2 to 3 weeks, and which will settle, and after that of course whatever the fat put will remain so permanently. So this is how the rejuvenation will be done around the eyes with blepharoplasty and micro fat grafting.